Hi folks, and welcome to another video. So my vegan trolls have been hard at work. Welcome to all my vegan trolls. You are more than welcome. The one thing that you're not allowed to do is just toss around insults. So I've deleted a few of those. But this particular guy, I had some interesting exchanges with him over this past week. Vonde, he's called. He responded here to something, a video about my clients are not eating enough eggs. You know, they eat one or two eggs and they think they're getting their protein, and that's just not nutritionally complete was the point of that video. He's calling me irresponsible. Fine. He's putting the ingredients in eggs. Kind of weird because he puts water as an ingredient. Okay. He puts amino acids and then he puts the percentage of amino acids in addition, like which specific amino acids. Amino acids are what we're all made of. Like it's good that eggs contain that. That was kind of the point of my video. Um, Whatever. Then he cites a video, he cites a study. He cites this study, which I've been looking at. Quite an interesting study because of it basically says the opposite. If ever you thought that eggs might be dangerous, this study pretty much disproves it. And let me explain why. So, this is the study here: associations of dietary cholesterol, serum cholesterol, egg consumption with overall and cause specific mortality, systematic review, and updated meta analysis. Now, whenever you look at this, the first thing I'm going to look at, whenever you look at anything like this, it's a big study, lots of people, and it's the first thing you want to figure out is this new data, right? And the answer here is absolutely no, it's not new data. It's a hodgepodge of old data, right? So one new analysis they've done, they've analyzed 27,078 men from the ATBC study. So that's alpha tocopherol, beta carotene, cancer prevention. So this was about antioxidants and cancer prevention. I assume it was seeing how much dietary alpha tocopherol and beta carotene people were eating and trying to measure that. And of course, some of those are in eggs, so they probably would have asked about egg consumption. So they're revisiting old data to try and find associations between egg consumption and all-cause mortality, right? That's one source of data, but that's a very small cohort because when I look at some of the numbers here, it's a lot more than 27,000. So they've also used even older data from the Prospero study, right? Prospero study was already a systematic review and meta-analysis of cohort studies, right? So this is a meta-analysis referring to a previous meta-analysis, right? It's got 482,316 person years of follow-up. So that's the first thing that I'd look at is where is it coming from. The second thing I would look at is what are the hazard ratios. Hazard ratios, just to remind people who may be new here, when we're talking about risk, what they're generally talking about is risk as a relative risk, right? So if we see in a data, so it's not risk, first of all, risk is a cause and effect statement. It's an association. So what you see, if you see in 100, if you have two groups of people, and out of 100 in group A, and there's a difference in group A and group B, let's say, I don't know, group A are Asian people, group B are European people. And group A, you get cancer at the rate of 1 per 100. So out of the 100 people, one person gets cancer over 5 years. And group B, two people get cancer, right? So that's an increase of 1%. 1% to 2%, 1 out of 100 to 2 out of 100. It's an actual increase of 1%. It's called an absolute risk increase or absolute increase in association of 1%. But that would show up as a 2.0, right? So that would show up as a 100% increase. It would go from 1 to 2. So if this number here, the hazard ratio, goes from 1 to 2, that's a 100% increase. And by the way, when we're looking at this kind of epidemiological data, this kind of data that wasn't designed to measure these results, you need to find at least 100% increase before you can begin to even think that that's relevant, before you can begin to even posit causation. This is the work of John Ioannidis, a great researcher out of Stanford, who's done really the hard work of looking through all the nutrition science and how junky it is, right? So what you don't have a hazard ratio of 2.0. You have a hazard ratio, actually, the actual hazard ratios for each 50-gram egg consumed daily, according to this data, were 0.6 and 0.9, right? Now, when you have all of this data and you can only find that kind of, like, it doesn't even get anywhere close. You're not getting it 50%, and you're bragging about 10% and 13%. So again, like to go from one person out of 100 to 1 and a 10th person out of 100, that's the difference between the two groups. It's pretty crazy, right? And then all of these other figures, these are all adjusted figures, and still they're not going much higher than that. When you have numbers of this size, so when you have 3 million participants, right? There's also this page here which shows, so the Asian studies, were at less than 1 million. The US was at more than 1 million. But what they found interestingly is that the association was completely in the US cohorts and not in the Asian cohorts. What does that mean? Is this something in Asian genetics that means they're invulnerable to eggs? No, this is all healthy user bias. In the US, people have been told since the 1970s to avoid eating eggs. So people who prioritize their health don't eat eggs. In Asia, people haven't received that kind of advice. So people who still consider themselves healthy, they still eat eggs, right? This is like, is it the eggs causing the poor health, or is it the eating the eggs that's causing the poor health, or is it the fact that I don't consider myself a healthy person that's causing me to eat the eggs, right? This is a very, very almost a conclusive case that eating eggs is not unhealthy, right? And when we look again at the tables here, so these are all adjusted data. And again, to get to anything that's relevant, anything that's even close to causation, we would need to see sorry, in this table, this is the RRs. We would need to see twos, right? We don't see anything like twos. In fact, some numbers are below one, meaning that actually the eggs were healthy in some of these assessments, right? So, I mean, what's a mystery to me is how this even gets published. When you have people taking massive data sets and combing through it for weak associations between eggs and mortality, and then doing things, making adjustments, age adjusted models, heart disease adjusted models, to try and increase it even more. And still, most of their multivariable assessments are actually showing that the eggs are healthy, right? So anyway, so I just want to make sure that we understand where we are, right? This science, this so-called epidemiological science, is pretty junky. It's not showing anything. There really is nothing to see in this chart or in any of the charts in this paper. It's kind of a miracle to me how it gets published. Now, what I really want to say, and what I think is the most important thing, is that eggs are an ancestrally appropriate human food, right? Humans have been eating them for at least 500,000 years, according to this. Now, this was about ostrich eggs. If anyone's ever seen an ostrich egg, you will know that it's about 40 times bigger than a chicken egg. Very difficult for a person to eat a whole ostrich egg. Like it's a whole meal at least, maybe a couple meals, right? So, but in this context, we have evidence that humans have been eating ostrich eggs from 500,000 years ago, right? And if we look at other kinds of birds, in some cases the evidence is even before that, millions of years ago. Now, humans in our current form, Homo sapiens, did not exist 500,000 years ago, right? So what we can say is, and there were previous hominins, Homo erectus, Homo neanderthalis, et cetera, that did exist, and they were eating that. Those are our closest relatives. So in that context, we can say that humans evolved with eggs as a food, right? Now, if you want to prove to me that eggs are inappropriate for humans, you have a lot of work to do. You can't do it with cheap associational data that show an RR of 1.1, right? That is crazy. That's never going to work, right? You have to actually do long-term controlled experiments, randomized, placebo-blind. I don't know how you give someone a placebo egg, but I don't know, figure something out, right? But of course, that's unethical because like it would be unethical to give a cat a vegan diet for a certain period of time. It's unethical to deny any animal the foods that it's meant to have, and eggs are among those foods. Anyway, that's some food for thought. Thanks, and I'll see you in the next one.